You're going to verify your order.
No.
So when you come in for testing, we'll give you one of these. I'll have a selection. We'll give you one of these. You verify your doctor's order, medication allergies. Down here it says NKDA, and then it says penicillin. So if NKDA is checked, there's no known allergies, but it says penicillin, so check that. Check compatibility of medication with existing IV fluids infusion. Okay, so if they have calcium gluconate, who has their Nursing Central up? And you can use that. You can use your Nursing Central. I will have this for you. I will have a drug guide, a paper. Y'all know what this is? So, I probably won't have that during testing, but I'll have these and you can write the same information. So verify that and verbalize that your medication is compatible with your IV fluids. Fibrites, I'm gonna, as you're saying this, I'm gonna be checking it off. So go through it. That's how you practice with each other. Prepare your medication correctly. So I have a Solumedrol. So my order says, patient has calcium gluconate 10% at 70 mLs an hour. Today, you're going to give Solumedrol 80 milligrams IV push now. Okay. So I have a vial with 125 milligrams per 2 ml, and I have a 40 milligram per 1 ml. Which one am I going to use? He needs 80. I'm going to use the 125. So who wants to do the math?
Was it
What was the amount again?
divided by 125 times 2.
Okay.
Who's got the calculator out? There you go.
Okay, so what am I going to round to?
3.3.
So then label it. This is what you'll see in the hospital, like I said. During testing, we'll have some little stickers for you. 2 10 ml syringes. Okay, so then you come into the patient's room, and then you're verifying their, he didn't have an armband, so we'll use this guy. Dr., let's see, Robert Davis, date of birth. He's got his identification on allergy again. Take your alcohol, scrub your hub for how long?
30 seconds.
Right.
You can do clean gloves.
Yes. Get clean gloves. Thank you. No, absolutely. So get your clean gloves, scrub your hub. Patent seed, how do you do that?
Flush.
Okay, are you going to try to aspirate?
Yes.
Okay. What if there's no blood back?
Doesn't necessarily mean I just
Right.
flush it.
Okay. So we use this one. So we scrubbed it, attach it, and clamp it. Okay. So it's patent. So keep in mind as I'm pressing, flushing it, I'm clamping it, slider clamp, just like that. All right. And remove your saline-filled syringe. Okay, it's compatible. So this is closest port to the patient. Okay, occluded in. So have an IV existing line, but anyway, your tubing would be here to be attached to here. So then you would have a. Well, you would, it's kind of, anyway, you would bend it, you know, where the port is. And then you would, let me see if I can find the tubing. The tubing with the port.
It's heavy.
this.
So true.
Alright, so this is hooked up to your fluids. And this is in your patient. So in this case, when they say occlude, close this, so everything's running, and you just bend it, that's occluding it. And you scrub your hub.
Or did you stop the pump though?
Yes,
Oh,
you can
okay.
pause it.
Okay, yeah,
Where's
because
it?
it'd beep like crazy.
Yeah. Let you know. Let's see, clean injection, occlude infusion, let's see, tubing just above the injection port, slowly inject the medication. If it's, compatible, then yeah, you just hit pause. Where's that at? There's pause. And then, get your medication. Slowly inject it, verbalize the appropriate time. So if it's over 3 minutes, so it's push 1 ml, wait a minute. Push another ml, wait a minute. Push the third ml, wait a minute. And then you can withdraw your syringe. Clean it. Then your flush. Attach your flush. And how fast does that go in?
Same rate.
Same rate, okay.
In a moment.
So, yeah.
You want us to do the full 10 or how many mLs? Just 3 mLs?
Yeah, it would just be 3 mLs per minute, right? 3.33, right? So then you push that in, same rate. And then detach that, restart your IV. Let's see. Should be,
It's the third one down there.
yeah.
Are you guys gonna
Restart.
tell us, or do we have to do compatible and incompatible?
I'm gonna surprise you.
Okay.
So be ready for all three. You don't know what I'm gonna
Okay.
pick.
Okay.
Yeah. Alright, basically that's it. Compatible, incompatible, it's just that with the incompatible, you're gonna actually stop it. No, you'd wanna break your line, but definitely,
So
yeah,
stop it and occlude.
yeah, occlude. You do your roller clamp, occlude it here. Scrub 30 seconds, attach your 10 ml flush.
And you do the whole thing.
For an adult, yeah. Flush it through. And then you give your bolus, right? There's your bolus over what rate? Same rate it was delivered. Okay, 30 seconds, 10 mLs again, same rate, okay? All this is stopped, the roller clamp is clamped, you're looking at your line, talking to Mr. Davis. How you doing? Watching him, is he turning blue, is he not breathing? Things like that, okay?
If we prefer to do the whole 10 mLs, even if it is compatible, can we do that instead?
With an adult?
Yeah. Like say if it's compatible and instead of just, just
I would just do, if it's compatible, I would just do 3, I mean,
Okay.
Yeah.
I'm just saying
If it's
like-
incompatible, definitely 10, that's, guidelines, then with the kid, then, 3. So then follow your line all the way up, unroll it, unclamp it, look at, restart, restart it and go again. And just watch your patient, redness, swelling, tender, ouchie, 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 it hurts.
I have a question.
Yes, ma'am.
So if it's supposed to be like 1 ml like per minute, would you push it and then wait a minute, or like do it slowly over the minute?
So what's
I don't know.
easiest?
Yeah, that comes to push it and
So,
wait a minute.
yeah.
Push it kind of slowly.
I mean, you could, I find it easiest, okay, push it, wait a minute, watch, okay. And then push it again, wait a minute, because the whole thing is, you're watching your patient for a reaction.
Okay.
I mean, You do have a little bit of dead space in there, but it's not gonna be enough, you know what I'm saying, to not see a reaction. But yeah, I think it's the easiest. I mean, if you're gonna, you know, slowly push your med, you know, I'm not that good
Yeah.
to sit there and watch my, you know, and
Yeah.
push that kind of
makes
thing.
sense,
So
though.
definitely push your ML. Wait a minute. Push another and then do it that way. Okay. All right. So now we have a saline lock. So we just come in. Any saline lock, and it looks good. So clean your port, of course. Then you have your 3 ml. And attach that. Of course, unclamp it then. Same rate as the medication. Slowly inject the medication. Okay, that was wrong. So let's, saline lock. Clean injection port appropriately with the antiseptic. Slowly inject medication and verbalize appropriate time. Okay.
So you wouldn't use a saline lock before? Maybe
Well, if
saline
you
flush?
had, yeah, that doesn't make sense. So
That makes sense.
we always,
Flushed it first.
yeah, I flushed it first. With the child, you would flush it first because you're checking for patency. But as Ms. Lopez said, if you're in with the adults, I mean, that's part of your assessment, and you're gonna take your
So you
syringes in.
already checked it?
Yeah,
Gotcha.
so that's with that, with a child,
Oh.
of course, you're checking it too. Most of the time, they have a KBO or fluids going. But yeah, you're gonna check it. So then you give your medication.
Yeah, that makes sense. Yeah.
Yeah. Attach the saline, and then, clean this, and then your saline. And then 2 to 3 mils at the same rate. So as you're finishing, you're down to 3 mils, you put that in, and you're still pressing on this, fumbling with this, and you're sliding your clamp, and that's creating a back pressure here, okay? And again, you're looking at your patient, how's the patient tolerating this? You know, are they still talking to you? It's a big thing. Okay? And just verbalize all that, and then you're gonna document it, everything you did. Okay? So when you come in for testing, so practice all these, because you'll be doing these multiple times throughout the day as a staff nurse, no matter where you are. And you'll come up to my table and I'll say, here's your test, here's your medicine, you know how to calculate, know your time. You're welcome to use your Nursing Central. Okay. I'll have the book there. You can use your calculator, you can use scrap paper, I don't care.